Hello, my name is Niall McKay, and welcome to Living with PSC, a podcast about the rare disease of primary sclerosing cholangitis. Now, PSC causes the bile ducts inside and outside the liver to become scarred, narrowed, and eventually blocked, and leads to liver cirrhosis. In this podcast, we aim to dispel some of the myths about the disease. So, I'm here with Trish Stoltzfus. Welcome, Trish.
Thank you, Niall.
Thanks very much for joining us, Trish. Now, Trish has been involved in the creation of a new disease classification code for primary sclerosing cholangitis for the first time ever. Primary sclerosing cholangitis patients now have their own disease classification, which is K83.01. So, Trish, would you like to tell us a little bit more about the new code?
It's very important for several reasons. One being for tracking patients, that when the providers are trying to do research and they're trying to come up with their cohort of patients that they're looking for, if we don't have a code specific for PSC, which we don't currently until October 1st. PSC is grouped together with all other types of cholangitis. So when the providers are trying to find these patients, someone's looking at these codes, finding these records, and then providers are having to manually go through all these records, trying to pull out just those patients with PSC. So it's very difficult to gather the correct patients without having a specific code for the
And
condition.
can you tell us a little bit about what you do for a living and how you're connected with
Sure.
PSC?
I'm the coding director for UPMC Pinnacle Health, which is an 8 hospital system in central Pennsylvania. And I've been in health information management for over 30 years now, all of it with coding in one way or another. So it was ICD-9 up until a few years ago when the United States switched to ICD-10-CM. And it kind of always bothered me why we didn't have a code for PSC, quite honestly. I didn't quite understand why we didn't. However, with what we've worked through for this last year, I've certainly come to understand it better and know why there wasn't one before. And we were able to make everyone understand why we do need to have one now. My connection to PSC Partners is very personal in that my youngest son, Travis, was diagnosed with PSC when he was 16. He's now 24. And I attended my first PSC conference back in 2012 in Minnesota, and I've been to every one since. And Travis came with me the following year to Pittsburgh, and he also has been to every one since. And we've PSC Partners is such a great organization, and we both will do whatever we can to help advocate and search for treatments and cures for this horrible disease.
What is the significance of ICD? What does it mean, or what do the codes mean?
ICD means the International Classification of Diseases. ICD-10 is the 10th revision of that classification. And these codes were developed by the World Health Organization, initially used to categorize conditions into numeric and now alphanumeric codes to track mortality statistics worldwide. So it doesn't matter where you are in the world, they can track the mortality. For instance, tracking the mortality rates for AIDS throughout the world by developing an ICD code for AIDS that made it very easy for those tracking purposes. The United States then has taken this system one step further, and the United States uses what's called ICD-10-CM, which is the clinical modification of these ICD-10 codes. And the World Health Organization gave the United States permission to create this subcategory of codes that allows the United States to use the codes for billing purposes. They still have to follow all the conventions of ICD, and their clinical modification still needs to be approved by the WHO. So our code for PSC is only used in the United States, will only be used in the United States beginning October 1st, and not throughout the rest of the world with ICD-10. It will only be the United States who uses the ICD-10-CM classification.
What should people do? Should people make sure, like, when you, after October, when you go to the doctor in the United States, should you make sure that they understand there's a specific categorization for the
Yes,
disease?
absolutely. Prior to October 1st, the code that PSC fell into was K83.0, which was a generic cholangitis code. Beginning October 1st, PSC has its own code. It will be K83.01. And then there is another code, K83.09, for all the rest of those cholangitis patients. So it's very important for patients to advocate and to let their physicians know about this new code so that they are getting categorized um, into the right code. So when providers and researchers are looking for the patients as we go down the road a year, 2, 3 years from now, they're able to find these patients quite easily.
Should it help in terms of trying to advocate for the disease?
Sure, absolutely. The easier it is to find the patients, the easier it is for anyone that's trying to do anything with them. Also, just I forgot to mention that PSC Partners will have a handout on their website that patients will be able to print to take that with them to their providers, beginning with any appointments that they have after October, to ensure that the right code is used for their visits.
So, for example, say I'm a drug company and I am developing, like there's several new classes of drugs that are being developed at the moment that help, regenerate liver
Hmm.
cells. How does it help me as a drug
It will
company?
help you as a drug company in that, obviously we still have the HIPAA laws, and you're not able to give out personalized information about patients. However, that doesn't mean that they can't use some of the data of grouping of patients. So they would be able to look at these patients. How many times were they hospitalized in a year? How many times did they have physicians visits? How many times did they have this particular test done or that particular test done? How many years did we have from onset of disease to possible transplant? There's just a plethora of things that can be teased out of the data by having an individual code.
Or before PSC Partners advocated for the name change, can you talk a little bit about the old code and why we needed our own? We're recovering a little bit, but can you talk a little bit about the old code and why we needed our own specific PSC
Sure.
code?
Sure. The old code, again, was a very generic code. Since PSC is a rare disease, when ICD-10 was developed, um, diseases are grouped together. And because PSC is such a rare disease, it didn't warrant, the World Health Organization didn't feel that it warranted its own code. However, as more and more liver diseases have been researched and have found ways to prevent and cure, we all know that PSC is one of the last diseases out there that we don't have any good treatment or cures for. So it became very important for us to have our own code. And last year, one of the international researchers actually got in touch with PSC Partners and asked if they would help advocate for a new ICD-10-CM code. And luckily enough, at the conference last year, I kind of got into a conversation with someone from PSC Partners and discovered what I did for a living and what they were asked to do, and it was a match made in heaven, so to speak. And together we were able to navigate through the system and make it happen.
It's a hard disease, first of all, to get diagnosed, and then it's a difficult disease to deal with, I guess, because there's so little treatment and stuff.
It's just how important it is actually, when you do go to your physician's office and when they're ordering tests, um, that every test that the physician orders for you, an outpatient test, be it an ultrasound, an MRCP, lab study, whatever it is, they have to associate diagnosis code with that test. And it's very important, again, for all of these tests to make sure that it is PSC. So, look at the papers that the physicians give to you. They usually have the diagnosis on them written out. You'll notice the code now. You may not have known what it was before, but there will be the code there, the K83.01 after October 1st that says primary sclerosing cholangitis. And if it's something else, if it's K83.09, ask them, can you please correct this? Can you please make sure it has the correct diagnosis on for us? In order to get this code approved, the ICD-10-CM codes are developed and maintained by the CDC, the Centers for Disease Control, along with CMS, the Centers for Medicare and Medicaid Services. So there is a coordination and maintenance committee meetings that they hold twice a year for groups to advocate for new codes or code changes, code modifications. So we were able to get on the agenda last September, and with the help of several leading hepatologists who were able to navigate the clinical piece of why we needed a new code for PSC, along with I knew it from the coding side and the coding perspective. I had the opportunity to go to Washington and do the presentation to the coordination and maintenance committee for asking for our new code. Then working with them over the next 6 months or so, 6 or 8 months, until we were finally able to get things settled and had this new code added. One of the things that was able to occur at the same time with getting the new code for PSC was with PBC changing their name from primary biliary cirrhosis to primary biliary cholangitis, made it very confusing in the coding world of where to code that disease. And so it was very easily to get it mixed up and coded the same as PSC. So for the coding professionals now, there's very clear delineation in the code books as to what code to use for PSC and what code to use for PBC.
This is fantastic information. Personally, I want to thank you for the work that you're doing and the work that you've done. It's very important to all of us, and it's one of the wonderful things about PSC Partners, I think, is that it gathers people like you together with all of these fantastic hepatologists and experts, um, with the actual the inmates, if you like.
PSC Partners is just a wonderful group, wonderful organization.
Yeah, and as you said, you go to the conferences. I go to the conferences. They're a great resource. There's all of this information there, and then all of this wonderful stuff comes out of them, where you get talking to somebody, and then so,
Right.
a year later we have our own code. So I just like to thank you for your service in that.
Yes, I have to say I would consider it one of the highlights of my career at this point. I'm just super excited about this code.
Trish, I think that's covers everything from my point of view. Again, is there anything that you'd like to add?
Yes, I'd just like to say be your own best advocate or be the best advocate for your as a caregiver. When you're in the physician's office and you're there for a visit and he's typing in his EMR, he's going to have to associate a diagnosis with that visit. Ask him what the code is that he's using. Be sure that he's using the K83.01. And if they're sending you for lab work or radiology, having an MRCP, um, anything like that, again, they have to associate a diagnosis with that order. Ask them what the code is that they're using and be sure that they're using the K83.01. We want to make sure that we're capturing PSC to absolutely the best possible way that we can.
Well, I'm afraid that's all the time we have for this week. For more information about PSC and for a list of people and topics we'll be covering in the near future, please go to www.pscpartners.org. That's www.pscpartners.org. PSC Partners is a non-profit organisation dedicated to providing education and support to primary sclerosing cholangitis patients. There is information and resources on the website. There is a conference once a year. There is a private Facebook group that you can also join. Also, please join our patient registry. This is an anonymous database that provides research support to the medical community who are researching this disease. Thank you very much for listening.